Hello there. Welcome to the Extraordinary Health Podcast with your host, Dr. Paul Bekkum, myself, Dr. Victoria Lau, and with Alli.
Hello.
Hello.
Today we are talking about joint pain and different ways that it can show up as symptoms in your body and different ways that we can help remedy it here at the office and with things you can do at home as well.
Yes.
Yes.
And joint pain is obviously probably, if not, probably the number one thing that people show up in the office for. So most people think of joint pain when they think of chiropractors, they think of the spine, because that's, 99 to 100% of chiropractors are literally going to be working on your spine. There's some that will get into other techniques, but my specialty personally is even extremities. I'm a certified chiropractic extremity practitioner. And, so not only am I looking at the spine, especially, where your brain and your spinal cord are housed and protected. So a lot of times I'm looking towards the spine for any kind of neurological problem that might be going on. But once it gets past that, then we start to look at more musculoskeletal things, joint pain being one of them. And because pain is usually that thing that brings people in the office, it's unfortunately in a lot of patients' cases, it's the tip of the iceberg. I mean, it's that pain is the thing that's the last thing to kind of show up. It's also the first thing to disappear usually when we get into treatment with them. And people can kind of be deceived, and especially in, the current market here right now where everybody's so used to traditional medicine and being able to just go into a store and even just purchase some kind of pharmaceutical that's going to help cover up the symptoms or cover up the pain. And, we want to target what's really causing the problem or what's causing the pain. And unless it's an acute injury, where you sprained your ankle or something like that playing a sport, or you slipped and fell on the ice, and you have an acute injury from that, those are a little more straightforward and people understand, there's probably something a little bit more going on here. Where people come in where they've had problems going on. It could be in a sports-related situation, thinking of things like baseball where, you get somebody comes in, hey, I've been throwing all year long here, and, it's all of a sudden my shoulder started to hurt. Don't have any specific injury that might have caused it. They end up showing up with what? The joint seems a little bit weak. It's not functioning the way it should. Occasionally, it might start to get stiff if it's been there for a very long time. A lot of times there could be swelling, and sometimes your body can be somewhat deceiving in that you don't even see the swelling because it's just so deep inside of a joint or something like that. That even the pain kind of masks it. You don't realize that there's inflammation that's going on with the pain as well. So, and most of the time they're going to get restricted range of motion too. So, using that analogy of a baseball pitcher here, think of somebody who's been doing it for 3 decades or something like that. They might wake up in the morning, it's stiff and sore. They don't quite realize that, hey, they've had some chronic inflammation going on and it's been getting worn down just over the years. A little bit different scenario than that person who's just been out just throwing the baseball currently, and they might even kind of push it off to that, it'll go away or whatever. But here they've now even started to cause damage to the joint because they've been just pushing through it. Then, in the old sayings would say, they just rubbed dirt on it and they just kept going. And in certain situations, that's good. But if you want to maintain close to normal function and be able to live at your full potential, you need to make sure you're dealing with these things as quickly as you possibly can. So,
Yeah, it doesn't get easier the older we get. Need to handle it now while you can.
Yeah, I mean, because when you're younger, I mean, you feel like you're bulletproof almost too, and you just think that you can just kind of push right through these things. And say you're a younger high school age kid. I mean, you might think that I'll just push through this here. I mean, if you have any kind of aspirations of going on into sports or something like that, whatever it might be, you better get that thing looked at and get it addressed sooner rather than later, because if you think you might be able to get a scholarship to go to school or something like that, that's something that, you better maintain your body now, because if you want it to work for the long haul, you're just setting yourself up for trouble, because that injury is just going to compound itself, even if you did take the medications or you did some exercises. But if you literally didn't get that joint corrected so that you make sure that you have the proper alignment of that joint, have the proper range of motion for it, build the proper strength back up and all the muscles that need to be supporting and stabilizing it there, you're going to have long-term issues here. So I think let's even kind of just go back a little bit further here, and even diet and nutrition wise, people just don't realize that, the food that they're eating, it can be helpful, but it also can be harmful. So, I mean, Dr. Victoria, you probably can even talk a little bit about that too. So,
Oh, yeah, exactly. Even just having three small kids right now that are in sports already, it gets hard. And just even looking general in this, we're talking about sports. So say you have kids in sports and you have to get from here to there and here to there fast, and you stop at McDonald's or you stop at Wendy's and you're grabbing something that's maybe not so healthy for you. Well, that's a compounding factor in what can cause ailments along the way. If we can, yes, think to prepare and maybe grab fruit or a nutritious snack along the way versus, always stopping at those fast food restaurants, and something that has sustenance to it. Those fatty acids are certainly going to help keep your body moving in the right direction and reduce that inflammation overall.
you're going to go home and make some salmon patties or something like that.
Yeah, exactly. I just send my husband out to go walleye fishing.
What are some snacks then you would suggest for someone to pack in their bag that
Oh, yeah.
would be
Well,
easy?
anything, fruit and vegetable wise, of course. Then you have to think along the ways of packing yourself a cooler and making sure they're ready to go. But simple snacks you can make at home are protein balls. You can grab seeds and nuts. Those are always a great thing to have on hand. There are some better snacks out there, even here at Costco. I found that there's better nutritious snacks, gluten-free snacks as well, that my kids enjoy. And you don't tell them, you don't have to say, hey, they're gluten-free. You just give it to them.
There's something for you to eat. I think the big key thing is to just, with anything, make sure it's balanced, just like a meal too, So, as you're thinking of making some of these things, I mean, I always think of some of the current things that are coming out, like Chat GPT. I've seen some people now, hey, what can I make for some food items now for the week here that's going to include this much, 30% proteins, 30% fats, and 40% carbohydrates. Come up with 5 snacks I can give my kids for a, sports practice this week. And next thing you know, it spits something out. And then if you don't like something in it, you can say, hey, remove the grapes, put in carrots, or whatever. So trying to use a little bit of the latest technology here to help out a little bit. But, once you kind of know the macros and as far as proteins, fats, and carbohydrates that you need to eat here, that can be super helpful. Get those omega-3s in there.
Oh, yes.
Make those protein balls
Yeah.
and find out exactly what you need to mix into those protein balls to get, a pretty decent ratio balanced diet for everybody here, so things don't get too out of whack there.
Dr. Victoria, you mentioned gluten-free. How can that be associated with joint pain?
Well, gluten in general probably isn't the issue at hand. It's just now what is in gluten, how we produce it, the chemicals and excess things that are in there that are starting to affect people more and more. Certain people might have what we call a gluten intolerance versus an actual gluten allergen. And there's ways to find out about that too, and that's something we're starting to work on here at the office and incorporating that with people's testing. But there's ways to just test that yourself, and that's through an elimination diet. If you remove gluten from your diet for a month to 3 months or so, you may see a shift in how you feel, if you have more energy, if you feel less bloated. But that in general just can cause inflammation, and we like to avoid that because inflammation just causes aggravation throughout the body.
Yeah, I mean, the big thing is to just, like Dr. Victoria just mentioned, like an elimination diet. I mean, if people do need some help with that, we do have some guidelines that you can follow here so you can start to eat a diet that's really low in foods that are going to cause sensitivities. You can obviously get lab tests that are going to actually show you the foods that you are sensitive to, and it might be, I guess the tests that we use aren't for IgE-mediated responses, which are those responses where you get an anaphylactic shock type of thing, like if you eat shrimp and your face blows up like a balloon. That's not what it's getting tested. It's testing for some of those allergens, which it might literally take anywhere from a day to 2 weeks for your body to even respond to it. And that's where an elimination diet, you want to do it for probably at least a month. I'd say that's a bare minimum. But I would even stretch it out to even about 3 months. Usually you're going to do it until you feel like, hey, your symptoms are pretty much gone, and you're starting to feel pretty good, because then what you want to do is you want to start adding some challenges back, and that's where you can add things back like gluten. Basically wheat is probably the main form of gluten, although there's gluten in tons of different grains. It could be very specific grains that you're sensitive to. The lab tests can help narrow that down for you so you'll know exactly what those are and how reactive your body is to them, so that you can eliminate the ones that are really causing the most problems. And then a good guidelines from like the Institute for Functional Medicine is, once you get to that point where you're doing that elimination diet and you're starting to feel good and you want to start adding back in that challenge, is to go, okay, what foods am I craving right now? It's like, oh my goodness, I haven't ate peanut butter now for a month to 3 months. I really want to eat some peanut butter. Well, make that your first challenge food then, to test it out and find out, hey, am I having some reactions here? But you're going to need to give it, at least a few days to kind of get a sense like, okay, am I noticing anything here now or not? And if you're not, you probably are pretty good to just add it back into your diet. I would just do it sparingly again as well. But yeah, anything you're going to put into your body that's going to cause an immune response is causing inflammation in your body. And any load on your body that's causing inflammation is just going to add to other things like joint pain, where there might be inflammation due to more a biomechanical situation that's just causing wear and tear on the joint. So,
and if anyone wants to listen more about like food reactions and elimination diets, we did do a podcast on it. So if you want to go to whatever podcast platform you listen on, back on February 6th, it's called Food Reactions. And it's all about elimination diets if you want to just get a little more in-depth information on that topic too.
One recommendation that I've always worked with, whether it's eliminating food or testing a specific supplement that your body may or may not need, is I've always recommended, say for an adult, say you're 35 years old, you want to think for every decade you've been alive to test the waters on being on that supplement. For at 35, I would say even 4 months to start really seeing a shift or a change in your body. That's just a great recommendation, because depending upon your age, but then also if you have any hidden factors like diabetes or any other autoimmune condition, it could take longer. But just thinking to have that bare minimum of the months for every decade you've been alive gives you a starting point.
Yeah, I mean, and yeah, we can probably talk about supplements here too. I mean, there's different things for joint pain that can be helpful there. And definitely, I mean, you get into things like the glucosamine, MSM. Sometimes I'll even have people take something called NAC or N-acetylcysteine. All these are kind of sulfur bonded supplements here, which it's not a sulfa drug, so these are not going to cause any issues with any drug allergies. It has nothing to do with that. I've had plenty of patients bring that up. It's sulfur, the mineral basically, and that actually helps your connective tissue pull water back into them. And that's what's really causing most people the problems with their joints as they get older, is that they're losing the hydration in the connective tissue in their joints. So you could even add in things like hyaluronic acid and all that sort of stuff. That's going to also help add some more moisture into the connective tissue of your body, which is not only in your joints, it's in your skin. So it can make your skin look healthier too for aesthetic reasons as well. But definitely going on that recommendation there for how long it's going to take. I mean, glucosamine, I usually tell people for sure it's going to take probably at least 3 months to really know whether or not glucosamine. You might know earlier, even within a few weeks, but MSM typically is going to kick in after a couple of days. NAC kicks in within a couple of hours. So that's why we'll have people use some of these different supplements to help out with joint pain and all that sort of stuff. So,
what are some natural like supplements that people could take that would also help with joint pain?
I mean, some people lately have been getting into like some of the bone broth types of things, and you can be mixing that right into maybe even soups that you're making already, or different other food items, so that you're getting some of the natural collagen fibers from the animals that they're making the stuff from there. You can obviously get that in a supplement form that you can drink as well there. I guess I always encourage people to use lots of herbs when they're cooking food items, because you can look at different things. Like a person for joint pain could use curcumin as the active ingredient, but turmeric is the spice that you can be using in your foods there. A lot of times you get that in curry powders and that sort of thing. Ginger is also a natural good one it's even anti-nausea for women that are pregnant and all that. But sometimes if you take it too much, that it might go the other direction. One of the more interesting things out here, which I've seen for like our neuropathy patients, is like CBD, or you can get into the hemp oils, which work with the cannabinoid system in your body for helping to decrease pain. That's more related to nerve-based pain.
But those oils be topical, or are they oils that you would ingest? Or is
There's
it both?
There's both. You can get topical things where they mix it into almost like an analgesic balm, and with an oil, it's going to get pulled right through your skin. But they also do make it where it's in a pill form. That's actually something I've just seen added with the supplement line that I generally recommend to people, because what I've seen with studies, it's going to act just the same as you're going to do with like a TENS unit or something like that, or even taking some of the medications for nerve-based pain. It's going to kind of just mask the symptoms there. I think you're probably better off using the oral form, so it gets throughout your whole entire body and gets absorbed all over the place. Because like the patients with neuropathy, they'll recommend like some of the CBD creams. It's a topical thing. It's going to last for a little while, but it's not fixing any of the problems.
It's more like an instant relief type.
Yeah, it's going to last short term. It's not, for the long term. I think if you want the long term, you better be looking at the oral based ones, so it can get absorbed into your system and be utilized a little bit better there then. So,
where could someone go to get like these type of supplements? You said you use someone specifically, or is there anything you recommend?
I mean, the company that I use the most is Thorne, and I have used an online kind of nutrition pharmacy through the office here called Full Script. I'm kind of looking at switching to just using Thorne, because they even have some lab tests that they've partnered with an outside lab company that we could even just send to people at home. They can literally, especially like if you're stressed or something like that, that's usually related to the nerves. Sometimes can be a pain thing here as well. And it can give us a little bit better picture of maybe what you need for a supplement here. We can also use the traditional labs that people can get done in a medical office. We can order them ourselves here too, and see if there's something more specific that you need that's showing up in your blood chemistry. That would be, giving you a much more targeted, reaction or targeted relief, because we can now see exactly how your body's responding to it, and obviously go back and repeat those labs after a while as well. So I try not to do things just based off of symptoms, because a lot of times, you might take care of the symptoms, but we're really not taking care of the root cause of the problem. I'd rather try and get down to the root cause of the problem so that people don't have this problem coming back either. So
one product that I've recently, well, not, I shouldn't say recently, because if most don't know, I've dealt with chronic Lyme disease now for a few years, but glutathione has been a great detoxifier. And there's so much I could talk about it, but basically it's getting to the root of oxidative stress and building up your antioxidants. But there's different forms of that and different ways of going about getting that as well. So glutathione is a big one.
Yeah, and that kind of even leads me into even some of the modalities that we have in the office. I mean, getting into like our laser, that is super helpful with joint pain. That's literally helping to stimulate the mitochondria of the cells, and glutathione can help that out as well, but helping to stimulate the mitochondria to produce more ATP, which is the energy for the cells, which is again also what glutathione helps with. So supplementing with glutathione or something that's going to help improve glutathione production in your own body can be very helpful. And then using our lasers, I mean, most people, they come in with a laser and they have a laser treatment. It's going to reduce the pain by 40 to 60%, right away here. And obviously, until we get it to go completely away or find that root cause of the problem, it's going to take a few treatments to do that. Mild cases, not as much. Obviously, more severe cases, a little bit more. I think I always say this, I see shocking results, but it's with our shockwave therapy, just how fast people get better using that there. And again, getting into using that, it definitely need to be taken. Some of the joint supplements like glucosamine, MSM, even NAC, a lot of the precursors to amino acids that help with producing the proper proteins and fats in your bodies, as well as hormones. Literally, I mean, the shockwave therapy, it's FDA cleared to help stimulate connective tissue. So all the joints, tissues that are, like your joint capsule, your joint synovium, so those connective tissues that are on the ends of your bones, and then the connective tissue that's around the joints themselves, as well as even the fascia around the muscle too. The shockwave helps to stimulate your body's own stem cells to help produce that. It also knocks down pain 80 to 90% almost right away. And besides that, it's long term also going to help reduce inflammation as well. So
that reminds me, I need my shockwave therapy today.
We'll get some shocking results for you.
Yes.
and another therapy, we'll try and wrap it up with this here too, is especially for joint pain, is our PEMF therapy. That's actually helping to put a charge back on your body's cells so that it can heal up properly. And especially, we use all these therapies here, even in conjunction. Say you had, a spinal problem, we're going to use some spinal decompression therapy as well to help restore those disc heights, hopefully as close to a normal status as possible. And just like I mentioned with everything before, using those supplements as well as the therapies is going to help to rehydrate those tissues, get those tissues to be and act more like a normal tissue again. And from what I'm seeing with the therapies here, especially with the shockwave, it doesn't matter how long it's been there. I mean, it could have been there for decades. I have patients coming in that have had chronic arthritic joints for decades. And in the past, with some of the other therapies we'd have, I'd tell them that we can maybe get 80 or 90% of that to go away, but it's getting way up there now with shockwave therapy, and just the pain reduction that we get for them too is just crazy. Yeah, you might have to come in for some touch-up therapies afterwards, where you might need to come in once a month or once every 3 months or something like that. But if you can be almost pain-free and live close to your full potential with where you're at, who doesn't want to do it? I mean, it's just a crazy effective therapy here that I think once people experience it even once, they're going to understand that, yes, this is going to help you out and you're going to get better with it. So,
yeah, and all the therapies that are offered are pretty passive therapies. Like the patient just has to essentially sit or lay there and just experience the therapy as it happens. Shockwave, can be a little uncomfortable while it's happening. And laser therapy gets slightly warm, but it's nothing dramatic that you're going to be like, wow, this is hot or anything like that.
It's not a cutting laser. It's a therapeutic laser that helps to, and it's really not even the heat that's the therapeutic portion of it. It's the frequency of the light. And our current laser has 5 different wavelengths of light that it's using. It does have a 6th. It's not quite cleared with the FDA yet So they haven't activated it here. So as soon as that gets cleared, there'll actually be 6 frequencies of light, from a blue light, which is the one that they're waiting for here, all the way up to a 1064, which they're actually using for helping to improve blood flow in nerve tissue, especially even in the brain for people that have Parkinson's, Alzheimer's, dementia, and all that kind of stuff. So I think that should be a podcast that we look at talking about in the future here too. So.
And then with PEMF therapy, the patient's going to be either laying or sitting, and it's really relaxing, actually. You just kind of get to close your eyes and have a blanket and relax.
And most people fall asliep with that once they get home. It's like
yeah, I'm guilty of that one. It's like you just lay there and you're like, oh, that was a great nap. And then also spinal decompression, which is also, they're generally laying down for that one as well, right?
Yep.
And on top of all of this is remembering to stay hydrated, especially all the time, but especially with doing excess therapies. We want to keep those joints and tissues extra hydrated during that time.
Really helps with the inflammation then as well.
Yeah, push that out.
Mm-hmm. It's flushing it all out. Yep.
All right. Well, we appreciate you guys listening. We covered with joint pain, food that could be helpful and foods maybe to eliminate, also supplements, and then as well as our physical therapies here in the office. So we will talk to you guys all next week with a whole new topic. Thank you for listening.
Yeah, have a great day.
All right. Thank you. Bye-bye.